When people are faced with getting a tracheostomy tube, the number one question many people have is, will I be able to talk once I get a tracheostomy tube? Many people avoid getting a tracheostomy tube, fearing once they have the procedure, they will lose the ability to speak. While I cannot promise if a person will or will not be able to talk after getting a tracheostomy tube, I will share with you tips and suggestions for learning how to speak with a tracheostomy tube. Once you have a tracheostomy tube, you will need to know the mechanics of speaking. If you use a ventilator, you will need to synchronize your speaking with your breathing. For example, you need to speak when the ventilator is exhaling. If you do not use a ventilator, you will need to occlude the tracheostomy tube to force air up the airway. To occlude the tracheostomy tube, place your finger over your tracheostomy tube and breathe out. This will cause all the exhaled air to be forced up your airway and through your vocal cords. Using your finger may cause bacteria from your finger to travel down into your airways. If this is a concern, consider placing gauze over your finger before occluding your tracheostomy tube. If you have a cuff on your tracheostomy tube, you will need to deflate the cuff completely in order to speak. A speaking valve may be used to help patients speak. This one-way valve attaches to the outside opening of the tracheostomy tube. It can be used with or without a ventilator. The valve opens when the patient breathes in. When the patient breathes out, the valve closes and air flows around the tracheostomy tube and up through the vocal cords, allowing sounds to be made. The patient breathes out through the nose and mouth instead of through the tracheostomy tube. Please note, some patients find the speaking valve to be helpful, while others find it makes speaking more difficult. Experiment using the speaking valve to find out which method works best. After getting a tracheostomy tube, your trachea will be swollen. This will make it difficult to communicate. However, do not be discouraged. Not being able to speak is normal. You will have to retrain your body how to talk. Just like a young child learning to speak, the first thing you will need to do is try making sounds. Attempt to moo like a cow, quack like a duck, or baa like a sheep. Any noise you can make will help you learn how to use new muscles to create speech. Another exercise you can do is to go through the alphabet and practice making each sound. It may sound something like this: ah, ah, ba, ba, ka, ka. Also try using different emotions. Try mooing, feeling happy. Moo! Try saying sounds when you're upset. Moo! Different emotions use different muscles to speak. When I first got a tracheostomy tube, being sarcastic was the one way I found I could speak. If I wanted to ask my mom to hand me a cup of water, the sentence would sound like this: "Hey, give me that water." Unfortunately, this was not a pleasant tone of voice to have, but eventually, over time, I discovered how to articulate words using all emotions. Breathing is important when trying to talk. When you lie down, it is very hard to push air up your airway and through your vocal cords to make sounds. If possible, sit up as straight as you can. Now, practice making sounds or uttering words. For me, I can speak fairly easily sitting up. If I lie down, it is very difficult to talk. If I try to speak when lying down, my voice is weak and often hard to hear. When trying to relearn how to speak, you may find there are certain words or sounds you can make which are easier than others. Once you figure out how to articulate a word or sound, practice saying it over and over again. Pay attention to what muscles you are using. Try to imitate the sound as best as you can. If you cannot figure out how you made a certain sound, be patient. You will most likely make the same sound again in the future. When you are able to say the sound a second time, try to repeat it. Eventually, your body will adapt to the new way of speaking and new nerve pathways will be established. Relearning how to speak may be a long process. For me, it took about 2 weeks before I was able to make noise and say words. It took about a month before I was able to speak sentences. Please remember, do not be discouraged. If you are angry or upset, use these emotions to help you speak. When you're upset or angry, you push more air in and out of your lungs. Use this time to practice speaking. You may find using your anger or frustration may help you relearn how to speak. One of the most important factors to speaking with a tracheostomy tube is using the right tracheostomy tube. You want the tracheostomy tube to be flexible and as thin as possible. Shyly tracheostomy tubes are often the tracheostomy tube of choice when receiving a tracheostomy tube for the first time. Shylys are wonderful tracheostomy tubes, but they are hard plastic. They do not bend and move. Moreover, if you use a cuff tracheostomy tube, the Shyly tracheostomy tube has a large cuff. The large cuff will make it difficult to speak. Your first tracheostomy tube is usually left in place for about a month to allow the tracheostomy site to heal. For your first tracheostomy tube exchange, ask your doctor if you can switch tracheostomy tubes. The tracheostomy tubes, which work best for speaking, are made from silicone or flexible plastic. In the United States, Bivona is the most commonly used silicone tracheostomy tube. There is also a company called Traco, which uses a flexible tracheostomy tube made from polyurethane. If using a cuff on the tracheostomy tube, the silicone tracheostomy tube has a cuff which completely deflates. This will make speaking much easier than using a Shyly tracheostomy tube, which has a bulky cuff. When I first got a tracheostomy tube, my tracheostomy tube was a Shyly with a cuff. I had a hard time speaking with this tracheostomy tube. The cuff on the tracheostomy tube felt as though I had a giant balloon in my airway, which inhibited the air from passing up my airway and through my vocal cords. Also, the tracheostomy tube is made from hard plastic. It does not move. For my first tracheostomy tube exchange, my doctor replaced my tracheostomy tube with a silicone Bivona. With this new tracheostomy tube in place, I went from being able to say a few words with a very weak voice to speaking in full sentences. With the silicone tracheostomy tube, it was much easier to speak. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.